Hi, welcome to TCTMD. My name is Mamas Mamas. I'm the Senior Clinical Editor and we're at India Live. Today, it's my pleasure to introduce Professor Maddury Jyotsna, who is the Head of Department in a hospital in Hyderabad. So welcome to TCTMD.
Thank you very much for this opportunity. I work in a government institution and it is a teaching institution as well. It is in the South India. And thank you for this interview.
No, so we had a very interesting discussion before the interview, and one of the things that we were going to talk about today is coronary heart disease in India. And really, maybe my first question can be, why do you think coronary artery disease presents so young in the Indian population?
Yeah, it is mainly, I think it's effect on the diabetes in the young females. As you know that in the whole of the Asian population, there is a drastic increase in the diabetes incidence. So also in Indian population. I can't say whether it is really because of the food habits or the genetic, definitely it is not. And it has become so frequent now, 13% of the people are suffering with diabetes, more so of the young people. That is causing a much more the increased incidence of the coronary artery disease. And second one is unawareness of the illness. So that's the reason why it is progressing very faster than occurring as well as in occurring in the earlier age group.
And in India, I mean, I guess, given the huge prevalence of coronary heart disease, do you have national screening programs or regional screening programs for detection of this early?
Yeah, we not yet started having a screening programs. To do the community-based studies itself, we are not yet tuned completely. So each and every incidence of the case, like increase in incidence of diabetes, we will talk in a particular regions. Like in the Chandigarh has conducted one of the regional studies, so we quote that much more frequently. But that may not be really representing from the North Indian population to the South Indian population. So we don't have the extensive epidemiological studies itself to know about the exact incidence of the diseases. So unless we know about that, for the government or anyone, even a non-governmental institutions to support the disease treatments or the disease diagnosis screening programs becomes a little bit difficult. So first we should know those national programs at the different areas to know the disease prevalence, and then yes, as you said, the screening programs are important. But as such, from the institutions and the different areas, we have the screening programs like a institutional based screening programs. Yes. Almost each and every hospital runs about it.
Okay. I mean, I guess we've talked about regional differences and some of the institutional differences. Clearly, there's going to be differences even in the presence of institutions between rural and urban areas. I mean, what are the sort of challenges that you see in practice, particularly in managing patients from rural areas that don't have access to these institutions?
That's true. That is one of the major point of discussion in an Indian population. Nowadays, the rural people also are the well-educated and they are aware of the diseases. But the major problem is they are so settled at the rural area, they don't want to come to the urban areas just for the treatment unless it becomes acute condition. So once it becomes an acute cardiac condition, it becomes transportation becomes a problem. Of course, there are some STMI from India. There are some other associate organizations are trying to send spoke and peripheral centers at trial. But I think less than 10% of the Indian population are included in them and really getting the benefit out of it. But I appreciate both state and central governments because they have schemes for the poor people. And once they come to the center or even in the periphery to have the thrombolysis and the transportation to the other areas, they are facilitating it now.
I mean, you talk about the national schemes, particularly about provision of health care to people that perhaps don't have the financial means to be able to pay. But even with those systems in place, do you see a difference in the quality of care between public hospitals versus private hospitals in India?
Yes. The major drawback for the institutional basis versus the private sectors are what I feel. It may not be the true if your private sector person talks, because I am from the government sector. So what we get the cases is usually complicated cases we get it. We is refused by the periphery people or the people who are the complicated and not to be managed because it's either expenditure is more or the hospital stay is going to be the more. Those people ultimately they'll land up in the institutions. So the institution cases are going to be much more complicated. But the same thing is not true for the facilities. Like in the private sector, they can have all the facilities are available. It depends upon the operators and their demands and supply by the hospital. But it is not so in a government sector for each and every area. A majority of the teaching institutions nowadays they are seeing that all the facilities are available. For suppose in the coronary artery disease itself, like having imaging is becoming one of the important procedures even in all the government institutions nowadays. But about if I talk about 5 years back or 6 years back, those facilities are not available. The same thing, so we see the complicated cases, but with the limited resources, we had to treat them.
I mean, you were and are an interventional cardiologist. Often, I guess, in your decision making when it comes to time for revascularization in patients with stable coronary artery disease, I mean, we know that there are trials that guide this practice. Whether they're applicable to the Indian population, is unclear. What are the factors that drive your decision making? Is financial an important part of that decision making?
That is one of the components, and simultaneously we have the religious and beliefs.
Okay.
So that is also an important. The financial is one of the determinant factor, especially if it comes to the female population.
Okay.
Male population, they think that anyway, he is the bread and butter of the family, so they don't mind in spending the amount of the money, whatever they have it. But for the same thing is not true for the female. Not that only the finances are the less for them, even though she is a working female, still she feels that more responsibility of giving to the importance to the husband than to the female. That is one of the features in here. And second one is Indian population, the religious features are very, very high. Many people after 60 plus, they consider that the life is, they're not certain about the age group and how long they're going to survive. So they want to go for the medical management, not to have the full investigations, not to have the complete treatment. Of course, in the past decade, there is a change in the attitude, and nowadays they are considering 70 and 80 years. Also, they are going for the treatment. But if you see the treatment-wise, like the TAVI is done in the 80 plus in the Western population. But here, actually, the TAVI incidence, when you're seeing the most of the 65, 67, 68. So for you people, it is a younger age group. For
Yes.
us, it is an older
Yes.
age group. So they are accepting is an okay, but really the 80 plus, none of the people will
Yes.
come here for the treatment for that. If at all you say that, okay, I'll take the drugs and I will see how I will do it.
I mean, you touched on women's cardiovascular health, and I know that you've done a huge amount personally in both increasing diversity within the field of cardiology, but also being a very strong proponent of women's cardiovascular health as a president of WinCars for 16 years. Where do you think the main limitation in getting equitable access for women in cardiovascular health is in India? What's the barriers?
The barrier is by female itself. She doesn't realizes that she has a heart disease, has to come for the treatment.
Okay.
She underplays all her symptoms and gives an importance to the family, and she doesn't even come to the hospital. Once she comes to the hospital, even with the MI, the late presentations and everything, recently we have a Shakti Enclave where we discussed about 20 minutes late presentation for the females, in educated females, in a center who is in the middle of India, that is from Chennai. So even though we know that late presentation occurs, not only that, even subsequent management also, they wanted to go for a lesser price treatment. Even in the drugs, if they choose in the medical therapy also, they don't take all the drugs which are prescribed, which are given a free cost for them, they will take it, but not for the things which are there. So there is an entirely some subgroup of the people, nearly I say 20% of the population doesn't take almost like a treatment even though they come to the hospital.
So with that, I'd like to thank you. It's been a really interesting and enlightening discussion, and I'd like to thank our viewers on TCT MD.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.